Welcome, welcome, welcome to another episode of Suave and Sassy Seniors with Sonia. I'm so excited to have all of you here. I'm so excited to be sharing with you some amazing people and products on this show. Now, just in case it's your first time watching the Suave and Sassy Senior Show with Sonia, let me tell you a little bit about my show. My show was developed to highlight some parts of our greatest generation. Many people feel as they age, they fade. But on this show, I have some amazing guests that are aging just like we are, like I am, but they're doing some pretty amazing things. And for our millennials that are watching, we always leave a golden nugget because you can learn a lot from people that's been through what you've gone through before. So I hope that you can glean some amazing information from my guest today. I've known him for several years and I cheer for him because he and I have a shared passion. We have a passion for our greater generation, which are our seniors that are above us and even people that are in our same age group. I'm going to bring Dr. Berland on screen with us and I'm going to let him share some of the amazing things that he's doing.
Hi.
Hey, Doc.
Hi, Sonia.
Hey. Thank you for being on our show today.
Thanks for having me.
Thank you. Thank you. So, Doc, you are a dentist. So could you tell us, how long you've been
Well,
a
I was a
dentist?
dentist. I don't practice anymore,
Oh, okay.
but
So
I
when you,
practiced for a long time, long time. And
oh,
before that, I was a denture technician in a dental lab. And then I was like the personal denture concierge in a practice that focused on dentures before I went to dental school. So I've been in the dental world. Actually, this is my 50th year. Because I
whoa,
started when I was 15 and I'm 65 now. Wow.
wow.
That's a lot of time in teeth.
That's a lot of time in teeth.
Yeah. Sink
So,
your
Doc,
teeth in that.
what started your passion? Was someone in your family in the dental field, or have you just always had a fetish for teeth?
Well, I come from a family of bad teeth. That's how it all started. And, when I grew up in Chicago, my extended family, we all basically lived in a couple of blocks. And all my grandparents and parents, they all wore dentures. And I had one grandmother who had a couple of teeth and a partial denture. And in the land of the blind, the one-eyed man is king. So Ethel, she had her, some teeth. She was special. And she would corner me sometimes, and she would say, and she'd show me her partial dentures, say, if you were a dentist, if you were my dentist, I would have had all my teeth. And so anyway, everybody always had dental issues and stuff like that. So, I grew up thinking that, working with dentures and replacing teeth was a noble profession. And that's how I started working in a dental lab while I was in high school, making teeth. And, after 50 years, I feel more strongly than ever that it's a noble profession. You really help people. And I was fascinated how, those little bits of plastic can totally change a person, because I'm 15 years old and I saw my family without their dentures, with their dentures. And then I started working, putting the teeth together, and you'd see the people. It was just mind blowing. So I fell in love with it then. It's a great job.
But Doc, it takes someone special to do that because now you and I know that denture wearers are not just for the elderly. The average age for denture wearer
Oh,
right now is about 35 years old because
um, no, it's actually getting younger
are you
all the time.
serious?
The last two data I saw, one was 29 and one was 27. I used to be, I remember it was like 40 years old, but it seems like first-time denture wearers are getting younger every year.
And that's
It's
a sad
shocking.
thing. And that's a sad thing, Doc, because denture wearers are, teeth. It not to have nice teeth or not to have any teeth, that really affects someone's self-esteem. I have an uncle. That's not an uncle. He's a cousin of my husband's that doesn't live in our city, and he got all on fours. And what all on fours are is 4 implants or 6 implants on the top and 4 or 6 on the bottom, and the denture hooks to that. You have no teeth in your mouth, and the teeth hook to that. And he got all on four because I don't think he had any teeth. And as soon as he got that done, within a couple of weeks, he had a new promotion on his job. So our teeth changed the way people see us. And it also changed the way we see ourselves. And also without teeth, you look older. It makes you look older. So dentures are important, and it goes in implants. So one thing I want to talk about with you, Doc, is your product. You have an amazing denture product called Clean-A-Dent, and I cheer for that. That's the only product that I recommend in the nursing homes, that I recommend to my friends and family that wears dentures. So I'm going to give you the stage, Doc, and I kind of want you to talk about. Let me see if I can get it where it's just on you. I want you to talk about your product. Oh, it won't let me do just you. It keeps doing just me like I'm the boss. So just want me. Oh, you know what I could do? I could remove.
How's that?
Go ahead and start talking, Doc.
Okay. I don't know what was going on. Well, I'll tell you, it's a fascinating subject about how denture wearers are getting younger, and about what a difference teeth and good-looking teeth can make a difference. Because it's you can't get a date, you can't get a job missing teeth. But anyway, I appreciate the opportunity to tell you about some of my products. We'll start with the Clean-A-Dent paste. This is the only ADA accepted toothpaste for the entire mouth and dental prosthetics. That means that it's good for your gums, your teeth, even implants. There's no fluoride in it, so it's safe for implants, and it's half as abrasive as baby toothpaste. And it moisturizes with vitamins A, D, and E, aloe vera, coconut oil, and tea tree oil. And what can I say? People love it. And then we've got the only ADA accepted denture adhesive that moisturizes, and it has no zinc, and it has a new copolymer. That's why it can work effectively without zinc. And it has vitamins A, D, and E, aloe vera. And the thing about a moisturizing adhesive is because it moisturizes, you can use less. And if you use less, you swallow less. And of course, it's more economic. But because a dry mouth, and I know, Sonia, you're an expert on dry mouth and aging people and medications that cause dry mouth. And a lot of denture wearers suffer from dry mouth. And dry mouth is the enemy of retention on a denture. So if you can moisturize the mouth, you have better retention, you need less. Then we also have, a big problem with denture adhesive is how to get it off. And it's not just denture adhesive, it's all that nasty biofilm with all the critters in there. So we invented the first and only denture in the mouth toothbrush. Now, it's kind of unique. It's got a groove. I'll take it out. Oh, tough to get out. Anyway, it's got a groove in the center so that it's easy to brush your tongue. And then this top tip can simultaneously brush your palate. And there's less gagging. And it's extra soft, and you can see the ergonomic handle. Then we have on-the-go Clean-A-Dent wipes. It's the same formula as the Clean-A-Dent paste, but now denture wearers can just carry it around with them. And when they want to clean or freshen up, they just go into the restroom. They tear out one of these little things. They can clean their denture, clean their mouth, throw it out, and pop it back in, the denture. And then this is a big bugaboo with dentures and basically all oral appliances, but especially dentures and oral appliances for snoring or sleep apnea, because a lot of denture wearers and apnea patients, they have the same comorbidities, high blood pressure, diabetes, and they're more at risk of infection from Candida, strep, staph, actinomyces, E. coli, and they are way more at risk at developing thrush and pneumonia. In fact, it's been estimated, according to studies, that up to 80% of all dentures over 6 months old are infected with Candida. So, you can imagine that most denture wearers have low-grade thrush infections. So we came up with the only liquid stroke cleanser. It's a concentrate. It just takes 4 pumps, and we recommend you use it in our new Sonic Cleaner. Our Sonic Cleaner can easily fit an upper and a lower denture at the same time. And it runs by USB and by battery. And anyway, 4 pumps, and that will disinfect and clean and deodorize and remove stain on any appliance and kills the Candida, strep, staph, actinomyces, and E. coli. You can use this on any appliance. The biggest problem with compliance on appliances is that they get gross. But you use this and you use the Sonic Cleaner, and your appliances are just like new. Any questions?
And Doc, I want to put this on the screen because this is something I wanted Dr. Berland to be on here because he was a dentist. He invented this product. He's worked with dentures for over 50 years. Listen, if you have dentures or partials are dentures covered with no teeth. Partials are appliances that fit missing teeth that's removable. The appliance is removable. So it's not a whole denture. Do not sleep in your dentures, because that can cause pneumonia. Please hear this. This is a very important topic because of COVID. It involves the mouth, and we don't know everything about this disease. So I encourage all of my guests, if you'll have grandmothers, aunts, uncles, if you wear dentures, listen to this, because this doctor is an expert in this area. These are dentures that I've taken out of someone's mouth. There are over 1,000 bacteria that can live on your denture. And when you breathe in your food, when you inhale, you are aspirating that in your lungs, and that can cause aspiration pneumonia. So it's imperative that you take care of your removable appliances. Take care of your dentures, take care of your partials. Another nugget that I want to drop. If you're wearing your mask and no one can see our beautiful smiles, and you have a partial or a denture and you say, well, nobody can see it, so I won't wear it. Your gums, if you have a partial, your teeth are going to shift. So you have to put that partial in every now and then, because if you would leave it out a month or two, it may not fit.
That's true.
And your dentures, especially that lower denture, if you're not wearing your dentures and you're opening and closing your mouth, that jaw is so strong, your lower denture may not fit anymore as well, or your upper. So if you have removable appliances, you need to wear them. 1, 2, you do not need to sleep in them. And 3, we have to keep them clean. Now, everybody who watched my show, I don't have a lot of products on here because I don't push and sell stuff like that. But I believe in this because it has natural ingredients, vitamin A, D, olive oil, tea tree. It's natural. It doesn't have all that zinc and other things in it that's toxic to our bodies. So if you or someone in your family wear dentures or appliances, partials, tell them about Dr. Berland. Tell them about Clean-A-Dent. He has an amazing website. You can go on the website to order his product. It'll be a link in the post with this video. Look it up. Share it. Share this post, because what sharing this this Facebook, this or this YouTube, wherever you're watching it at, you can possibly save someone's life. And that's what we want to do. We want to help people. I'm going to move this denture because it looks kind of bad, but I'm sorry to keep it up there so long, but this is what people have under their dentures. And look at Dr. Berland adhesive. Now, some people you have to use adhesive to hold their pliance in. He showed it, but look at it's zinc free. It has all these natural vitamins in it. Where this has all of these, I don't even know how to say that word, but I'm gonna try it. Meth, and somebody gonna text me and correct me because there's always a know-it-all in the group. Somebody got to know everything. Okay, so methyl biolether. What you think, Doc?
I don't know. I need my glasses. These words are too big for me.
Okay. So, but it has, I don't believe in doing stuff that I can't, it has red 30. What you say?
It's a biggie. Methyl vinyl maleic acid.
Yep, he said it. So, and this and that. And but with the Dr. B adhesive, because a lot of people who wear adhesive, wear dentures, they have to put adhesive on. Just one more little nugget for you. If you wear denture adhesive, this is all you need. Now, let me tell you something. You only need, and that's one too many drops. You really just need 3. But some people putting a whole glob around it like this. If you have to put a whole glob around your denture, you need a reline. You need a new denture or a reline. A reline is when they put some sort of denture material in it and make it fit again. And I'm gonna give you one more nugget. Dentures are not meant to last a lifetime.
Yes. Thank you.
They're not. Now your teeth were meant to last a lifetime. The teeth not supposed to come out when you get old because your arm don't supposed to fall off when you get older. But so teeth are meant to last a lifetime, but not dentures. Now I know in many states, Medicaid only pay for one set of dentures a lifetime. But dentures are not supposed to last you all your life. I think life is about 3 to 5 years, Doc.
I would say anywhere from, Frank Sinatra replaced his denture every 6 months because he didn't want the ridges changing and affecting his voice. So, there's really no guidelines. You can't replace them too often. Nowadays, with digital technology, it's so easy. It used to be you'd have to start over with the impressions and the bite and the try-ons and stuff. But now, once somebody likes their denture, you can just scan it and press a button and either mill or print a new one. And you can even use different colors, different shapes. But I think this is going to really revolutionize things because people didn't want to go to the dentist. They didn't want to go through the whole hassle of starting all over. But with a digital denture, they can just take an impression in the old denture, scan it, make a new one, and it's really going to change things. I just wanted to say what you were talking about, saving someone's life with these products. You're correct. Somebody who sleeps, first of all, a denture wearer is twice as likely to come down with pneumonia and thrush as a non-denture wearer. And if they sleep in their denture, which usually means they wear their denture almost 24 hours, because they don't wear it just to sleep. That means they just wear it all the time. They are 4 times as likely to have pneumonia or thrush. And these can be deadly. The ADA did an article about me when we first released our products, made them available years ago. And after it was published, I heard from 2 dentists, one from New Mexico, who told me that her mother was having terrible stomach pain and kept being hospitalized, and they couldn't figure out what was wrong with her. And they took her to the Mayo Clinic in Minnesota. And it turned out that she had a thrush infection in her stomach that was traced to her denture. And this was a dentist who had the means and the curiosity and the knowledge to take her mom to get cured. And I also heard from a dentist in Seattle who told me that his father died like 30 years ago, of pneumonia, and he always thought the denture had something to do with it. And when he read the article, it was confirmed. So what I'm trying to say is a lot of these people, they're older, they're not in the best of health, and they have, other issues going on. And when they come down with thrush, pneumonia, it could even lead to oral cancer. People don't think about their denture. And of course, I have the best denture cleanser out there, and it does kill these microorganisms, but a denture is still a porous material. And the ridges do change. So I really think as you said, every 3 to 5 years, I think that's a good time. Though I know people are wearing their dentures 10, 15, 20 years. I mean, I saw it in my practice. Yeah. What happened in my practice, this was interesting. There's this huge misconception that denture wearers are, they're economically challenged, they educationally challenged, but that's not always the case. In my experience, denture wearers come from all walks of life. And there's a lot of reasons why people are wearing dentures. It's not just, bad dental care. It's not just accidents. There's a lot of reasons. And the biggest driving force for dentures, I'm discovering now, especially with young people, because I'm a member of all these Facebook groups and stuff, and I'm aware that there's a lot of young people getting dentures. It's cosmetics. As you talked about your husband's uncle, how his life has changed since he got his teeth. You just can't like I said, you can't get a date, you can't get a job nowadays if you got a jacked up smile. And if you're missing a couple of teeth, or they're ugly or something, dentures were the original cosmetic dentistry. All the movie stars had it. All the singers had them. They all had dentures, back in the day, before your time, but in my time, they didn't have implants. And I can tell you, I know a lot about teeth. There's a lot of movie stars right now that have been through dentures. They've had different teeth. Now they've got all on four. I know a lot of celebrity patients and celebrity dentists. So it's, full arch treatment is here to stay. And I got distracted. What I was going to tell you is I was pretty well known in the dental field because I wrote a book 20 years ago called The Smile Style Guide, better known as the Lauren Library for Cosmetic Imaging. And I did this book. It was 18 sets of a smile design with variations of length, but mostly it had to do with shape of the 6 front teeth. And I confirmed it with science, verified by nature. But the way I developed this is when bleaching started becoming popular in the early 90s. I was practicing in Dallas, and I was the first fellow in the American Academy of Cosmetic Dentistry. So I had a little reputation in Dallas for being a cosmetic dentist. So bleaching became popular in the early 90s. And I started seeing all these wealthy women from Dallas whiten their dentures.
Wow.
Everybody was getting whiter teeth and their dentures weren't whitening. And, these were society women. I didn't know. They were all from West Texas. And it turned out they all knew each other once I started seeing one. But they all had severe fluorosis, which gave you mottled enamel. And so a status symbol, instead of being a low symbol, but a high symbol, was to get dentures when you graduate, get married, something big. And you would get a beautiful A1 smile, which was which was crazy white in those days. And these people, these women, they ended up, going to college, SMU in Dallas, ended up staying in Dallas. And same with tetracycline stain teeth. I saw a lot of people who had their teeth pulled because they had tetracycline stain. And usually their parents were either doctors or dentists. I mean, this is, in the 60s. 70s. They, because they had access to the tetracycline before they found out it stained their teeth. And I would see these people after they had dentures, and they wanted whiter dentures. And I said, we can't whiten your dentures. We can remove any stain. But while we're doing it, why don't we change the shape and play with the length? And the beautiful thing with dentures is you can do it with a wax try-in. You can't do that so easily with fixed porcelain and stuff like that. So what I'm saying is, I am saying, I know there's a lot of people who know more about dentures, but I think I'm up there in the top for knowing the most about denture wearers right now.
Yeah, Doc, you know a lot about
my life. It's been my life for 50 years. Getting to know them, understanding what they want. So all of my products, I didn't really come up with them. They literally popped out of my patient's mouth so that I can make them and put them back in their mouth. But, this is stuff that they all told me they wanted.
But Doc, you are the denture
king. Too much.
You are the denture king, denture king, denture king, denture king. Doc, I want to thank you for sharing so many nuggets on our show for our younger people, for our older people, for our middle-aged people. And this is what I'm going to do. The person who shares this video on all of their social handles, not all of them, Facebook, and YouTube and Instagram, I will make you a basket of Dr. B's products and send it to you. Now that would be the adhesive, that would be the toothpaste. Listen, and I'm going to tell y'all one more thing. If someone has dentures, do not brush your dentures with regular toothpaste.
Oh God, thanks for saying that.
Please. I hope you stayed on to the end. Do not brush your dentures with regular toothpaste because they're not teeth, and toothpaste scratches the denture and it leaves little cracks in there, and then you have bacteria that get in there and it smells. Listen, I can smell someone's denture in a grocery store. If someone is you can't smell what your denture smell like because it's in your mouth, but it has an odor. So if you're brushing your dentures with toothpaste that's putting little scratches in it, bacteria is living in those scratches and it has an odor. So there's special toothpaste just for dentures. Even if you don't want to order Dr. Berland's toothpaste, which I highly recommend, get a denture toothpaste, please. Don't use regular toothpaste on your dentures. So in the packet, I will put adhesive, toothpaste, the wipes, which are amazing. So if you at a restaurant or something, you could go in the bathroom, kind of take your partial denture out and clean it off. And I will give you the crystals to soak your stuff in. And the bonus, I'll send you out the little box of the Sonicare, the Sonic cleaner. So you have to share it on YouTube and Facebook and screenshot and send it Facebook messenger it to me, and then you'll be entered into a drawing, and I'll send out 2. So let's get the news out. Let's
make it 3. 3 is a lucky number.
3 is a different. 3 is a number. Denture King. So thank you all for listening. Thank you all for being a part of the Suave and Sassy Senior Show. Doc, thank you so much for being here today. You're simply amazing.
Well, I know I'm a senior. I'm just Suave and Sassy.
Thank you all for being a part of my show today. And
thanks for having me.
Continue to watch this every first Thursday of the month. And we're so excited to be bringing you another show. Bye.
Bye-bye. Thank you.